Good afternoon, my dear listener. The topic of our day today: new paradigm for pharmacy practice. The main task of today's lecture is to form the attitude to profession of pharmacy and understanding of its role in modern process of pharmaceutical providing the population. We'll stop shortly on the question of a new paradigm for pharmacy practice. The main references that you may study more detail you can see in the list. Today, the pharmacist's roles in many practice settings has expanded. Medicine use has grown dramatically. The population has aged. The prevalence of chronic diseases has increased. New infection diseases have emerged and the range of effective medication has broadened. The new medical technology has opened. The number of medicines on the market has increased dramatically over the last few decades, bringing some real innovation, but also considerable challenges in controlling the quality and rational use of medicine and change the role of the pharmacist. According to the data of World Health Organization, global spending on medicine continues to grow. In developing and industrialized countries alike, efforts to provide health care, including pharmaceutical care, are facing new challenges. This includes the rising cost of health care, limited financial resources, a shortage of human resources in the healthcare sector, inefficient health system, the huge burden of diseases, the changing social, technological, economic, and political environment which most countries face. Health promotion, disease prevention, and lifestyle modification are activities at community level that have a public health focus. Pharmacists can offer public health intervention more conveniently than other groups, since they are easily accessible and recognized as an expert on medicines of healthcare. Pharmacists are a trusted source of information and advice on health and medicines. However, they cannot operate in isolation and must accept joint responsibility with all health professionals to serve community and public health goals. Access to medicines of issued quality remains a major concern worldwide. 1/3 of the world's population do not yet have regular access to essential medicines. For many people, the affordability of medicine is a major constraint. The inequalities in access can be divided according to the different reasons such as awareness, geographic, financial, preference, and prescribers. Another major challenge is ensuring that medicine are used rationally. This requires that patients receive medication appropriate to their clinical needs, in those they meet their own individual requirement for adequate period of time, and at the lowest cost to them and their community. All these challenges, access to medicine of assured quality and to their rational use, underscore the urgency of the need for global health sector reform. Against this backdrop of ongoing and profound changes in healthcare delivery system, a paradigm shift in pharmacy practice is occurring. Public health interventions, pharmaceutical care, rational medicine use, and effective medicine supply management are the key components of an accessible, sustainable, and affordable and equitable healthcare system which ensures the efficacy, safety, and quality of medicine. It is clear that the pharmacy has an important role to play in the health sector reform process. To do so, however, the role of the pharmacist needs to be redefined and reoriented. Pharmacist has the potential to improve therapeutical outcomes and patient quality of life within valuable resources and must position themselves at the forefront of the healthcare system. This changing vision for the practice of pharmacy got an important boost in 1990, when Helper and Trant coined the term pharmaceutical care. Over the next decade, it became a buzzword promoted by pharmacy organizations. Pharmaceutical care embodies a patient-centered, outcome-centered practice of pharmacy. This practice model promoted the pharmacist as a key member of healthcare team, with responsibility for the outcomes of medication therapy. The emergence of the pharmacist patient-centered role was reinforced in those years when the American College of Clinical Pharmacy issued a white paper, a vision of pharmacists' future role, responsibility and manpower needs in the United States. And some others also have launched initiatives designed to support an expanded role for the pharmacist and to increase recognition of the profession. Additional information you can find at reference shown in list. Based on all of these challenges, the pharmacy practice shifted its paradigm from product-centered distribution activity to a patient-centered system, where the pharmacist got a new responsibilities, helping patients achieve the best healthy outcomes. Thus, a new paradigm for pharmacy practice includes establishment of a new relationship with both patients and their healthcare providers in order to get the better outcomes. Pharmacist is well informed and certified to prepare and dispense drugs and to offer drugs and associated information to the community. To be effective healthcare team member, pharmacists need skill and attitude, enabling them to assume many different functions. Thus, pharmacist of the future has been described as 7-star pharmacist, someone who is equal in excellence to a 5-star hotel, yet accessible to everyone from the richest to the poor. The concept of the 7-star pharmacist was introduced by World Health Organization and taken up by International Pharmaceutical Federation in its policy statement on good pharmacy education practice to cover these roles. Caregiver. Pharmacists provide caring services. They must view their practice as integrated and continuous with those of the healthcare system and other health professionals. Decision maker. The appropriate, safe and cost-effective use of resources should be the foundation of the pharmacist's work. At the local and national levels, pharmacists play a role in setting medicine's policy. Communicator. The pharmacist is an ideal position to provide a link between prescriber and the patient and to communicate information on health and medicine to the public. He or she must be knowledgeable and confident while interacting with other health professionals in the public. Manager. Pharmacists must be able to manage resources, human, physical and financial, and information effectively. They must also be comfortable being managed by others, whether by an employer or the manager, leader of a healthcare team. Lifelong learner. It is possible to acquire in pharmacy school all the knowledge and experience needed to pursue a lifelong career as a pharmacist. The concepts, principles, and commitment to lifelong learning must begin while attending pharmacy school and must be supported throughout the pharmacist's career. Teacher. The pharmacist has a responsibility to assist with education and training of future generation of pharmacists and the public. Participating as a teacher not only imparts knowledge to others, it offers an opportunity for the practitioner to gain new knowledge and to fine-tune existing skills. Leader. In multidisciplinary caring situations or in areas where other healthcare providers are in short supply or non-existent, the pharmacist is obligated to assume a leadership position in the overall welfare of the patient and the community. Leadership involves compassion and empathy, as well as vision and the ability to make decisions, communicate, and manage effectively. And the added function is researcher. The pharmacist must be able to use the evidence-based scientific pharmacy practice health system effectively in order to advise on rational use of medicine in healthcare team. Thus, the current era of globalization has witnessed evolution in the professions of healthcare sector, especially in pharmacy. Over the past 50 years, the pharmacist's role has changed from that of compounder and dispenser to one of drug therapy manager. Whereas previously the pharmacist worldwide was seen as responsible primarily for manufacturing, compounding and supplying medicines, today the pharmacist's role has evolved towards a clinical orientation. This involves responsibilities to ensure that wherever medicines are provided and used, quality products are selected, procured, stored, distributed, dispensed, and administered so that they contribute to the health of the patient and not to their harm. The scope of pharmacy practice now included patient-centered care with all the cognitive function of counseling, providing drug information and monitoring drug therapy, as well as technical aspect of pharmaceutical service, including medicine supply management. But the profession is still under continuous transition. With change in the health demand, pharmacists have a further role to play in patient care. Thank you for your attention, and you are welcome at our next video.